You should be ready to go.
Okay. Good evening, everyone. Welcome to this Southeast Region driven webinar. I'm Yann Ledoux, Chairman of the Southeast Region of NSA, and on behalf of our Regional Committee, I'm delighted to welcome you to this, our fourth Sheep Health, Wealth and Production Conference. While I'm disappointed that I can't welcome you in person and chat over a cup of coffee between sessions or over a post-conference meal, as we have done in the past, I must take the positives from the use of this online format, and that we are welcoming participants from across the UK and indeed from mainland Europe and possibly further afield. First, just a few housekeeping points before we go on. We're recording all the sessions so that anyone who has registered and who can't attend for whatever reason or who wants to listen again can do so at their leisure. As we proceed through the evening, if you have any comments to make, please put them in the chat box. Similarly, any questions, please use the Q&A. We have Neris monitoring these and to help with the Q&A session later on. And don't forget, there's no such thing as a bad question. Also, as you can see on the screen, we have a collection of sponsors who I'd like to thank very much on behalf of my committee. You can see there, Datamars, MSD, Rapper and Elanco. Okay. Each of these 3 consecutive evenings of the conference has a specific theme. The first tonight is health of both sheep and that most important element of our production systems, the shepherd. And they're the one that gets forgotten sometimes, I think, when we're talking about the health of our flocks and our industry. And now I'd like to hand over to Phil Stocker, our Chief Executive of the NSA, who will be our chairman for this evening, to get proceedings underway. Thanks very much. And over to you, Phil.
Thank you, Yann. Thank you. And yeah, just like to add my welcome to everyone and thank everyone for joining us this evening. And if I can just say a huge thank you to our Southeast region as well for pulling this event together in a very innovative way. As Yann said, this is the 4th SHWAP conference that the Southeast region has held. And, you know, it really shows innovation in action, I would say, to be doing this online. I know it's been enforced on us a little bit, but yeah, a huge thank you and appreciation to the Southeast region for doing this. Again, as Yann said, it would be nice to be able to meet in person and be able to see each other face to face. But there are benefits. You know, we've not had to all tear across the country. We've got some fantastic speakers from right across the whole of the UK. We've not had to sit in traffic jams. And some of us haven't even had to have a shower before we come out, and we can return to our normal life when the webinar's over. So, you know, there are benefits, but one day we'll get back to doing these sorts of things face to face as well. So we've got a fascinating evening this evening. I mean, the whole program over the next 3 days looks really, really exciting and interesting. But this evening, as Yann said, there's a real focus on flock health. Health planning, using technology and tools to aid sheep health. We've got 2 Fionas, Fiona Lovatt from Flock Health Limited, and then Fiona Kenyon from the Moredun Research Institute. And just to prove that you don't need to be a Fiona to get on in the world, we've also got an Eleanor Sanger from the Farm Safety Foundation, who's going to talk to us about farm safety and health. And as Yann said, you know, we're not going to tick any of those other boxes. We're not going to achieve health in our sheep and good welfare in our sheep and good production or productivity unless the health of us as farmers and as shepherds, both physical and mental health, is at an optimum level. So, you know, I really welcome the program this evening. You know, it's great to have everyone join us, and thank you very much to our speakers. And I'd like to pass over to begin with to Fiona Lovatt. Fiona Lovatt will be well known to most of us this evening. Fiona runs Flock Health Limited, a sheep veterinary business, which really is push the boundaries in terms of encouraging proactive veterinary involvement, advice and support on sheep farms through individual flock health planning and the development of flock health clubs as well. Fiona is also a clinical associate professor at the University of Nottingham, with a very active involvement in clinical undergraduate veterinary studies and supervision of small ruminant research. So she is immensely qualified to be here and talk to us this evening. And Fiona, I'll pass over to you.
Thank you, Phil. Excuse me as I just try and share my screen. I think that's shared.
Yep,
so
that's good. Sheep
flock health planning, you couldn't ask me for a more favourite subject of mine, but as many of you know, the sheep industry I am passionate about. I now can't get my slides to turn on. Move on. Haha. Our UK sheep industry, as I don't have to tell many people in this audience, is hugely significant. So it's the largest sheep producer in Europe, 5th largest globally. I think that's still right. And we have approximately, Phil might correct me here, 60,000 sheep farmers in the UK, 15 million breeding ewes, and we have 40% of the total livestock biomass in the UK. That is how significant. I use this slide a lot for vets when I'm pointing out to vets how important our sheep industry is. And I know here I'm preaching to the converted, but what is good sheep farming about? So I suppose essentially it's producing a quality food product. I don't think always as vets, or potentially even as farmers, we think of that as our primary reason for being, but food industry is very much where we're at. We're managing the land sustainably, and I will speak today as if you are planning, you are trying to run a viable business. And I know that not everyone farming sheep is, but that's where I'm kind of coming from, and that's where we tend to talk about the economic importance within sheep farmers. So where do vets fit into this? So arguably I'm a bit biased, but I would say that vets are an absolutely essential part of any farm team, and that's ensuring health and welfare of the sheep. We are the guardians of animal welfare, and sheep no less than any other animal. And I would suggest the health, wealth and welfare of the shepherd, of you guys. And so as we work alongside that farm team, ensuring optimum flock productivity and performance alongside proactive preventative medicine. And I think the preventative medicine is a really key part of it. So as a vet, and as a vet who says, I am a sheep vet, there are not many of us around, but I have heard endless times through my career, people say, what, you're a sheep vet, but surely a cost of a sheep is not worth the price of a vet's bill, or something like that. They're always saying. And I'm like, yeah, but you don't have one sheep. You might have 500 or 1,000, and actually ensuring the health of that flock of sheep is absolutely where we see our place within the sheep industry. So as we're looking at flock profitability, we do need to ensure that I don't know whether maximum flock output is actually that fair, definitely optimum flock output. We're not always maximising the numbers of lambs sold. Potentially, if you're on the hill or you're, lambing, ewe lamb, shearlings, you don't always want a high scanning percentage, but we do need to be doing it at minimal costs. So, and we need to be, in whatever way, spreading those fixed costs over plenty of lambs, and making sure we're efficient with our variable costs, so that we can produce lamb at maximum product value. And what a brilliant year it's been for good value of product. It's fantastic when lambs are making a good price, but actually as we put our lamb production and are selling lambs at the right time, target markets, and actually we're concentrating, we're not just thinking of the flock as a whole, but actually segmenting the flock in a way, and maybe putting our earlier ram lambs out at a certain time, or whether we're castrating certain lambs, we're actually thinking about the flock, breaking it down, rather than just here's one group of sheep, but targeting our production. So to maximum output, yes, every lamb counts. We do want maximum born, but we definitely want to keep maximum alive. So and we need the ewes to be in optimum health to do that. So that crucial first 6 weeks of a lamb's life, as the growth that the lamb makes then will determine how well they're doing, how well they're going to finish. And we need to be keeping lambs alive. The ultimate is obviously to be either retaining decent ewes to come back into the flock or selling lambs at the optimum time. So every single stage, we need a robust flock. So we don't want anything to come in to jeopardise that health and productivity of either our ewes or our lambs and cause that unnecessary wastage. So it's great looking at the potential of the flock at scanning time. Quite frankly, what your scanning number is not the number I'm most interested in, but actually what we send at the end, sell at the end of the the productive year or productive time, and actually reducing that wastage is really, really important. And then we're looking at the costs, and we need to reduce costs, and we know that cost replacements are always high, whether you're breeding them own or whether you're buying them in. Feed costs, and people have made great progress in reducing feed costs. Not right along board, that's generally one of the biggest costs. And the vet and med is always the cost where people come and talk to us about it. And I'll break it down, and some of you have seen this slide before, but there's kind of no excuse that there's always the bad vet spend. So anything that's a vet and med cost, which is a treatment, or because you've got diseased animals, or because animals are not performing, or because animals are dying, or actually because you're treating a disease, that to me is a sort of cost that we must reduce as much as possible in any flock. But the only way we can do that is actually to be investing properly in preventative measures. And whether that's proper flock health planning, making sure that our flock is robust as possible, and often vaccination comes into that. There's the splitting out, and we're doing a piece of work at the moment looking at the division between reactive spend, stuff we have to go in and spend because things have gone wrong, compared to the spend that we put up front and actually works for us. So it's an investment in the flock. So every cost in the flock must be an investment. So as we look at flock health planning and through the year, and starting a typical year, coming into autumn, start of the year, and then just where the vet, or where we often get involved in flocks, and absolutely, as before the taps go into the ewes, making sure we've got the right ewes in lamb at the right time of year. And then the time of year that actually is, because most of our work is in preventative, January and February is a hideously busy time as we're working through forage analysis, planning diets, that key getting ewes right at that crucial knife edge time of the year. So as they go into the lambing, so they go into lambing time, actually we know that the ewe is in good body condition score, that she's milking, that she's going to milk well, that she's producing decent colostrum. And we've done just this last lambing season, we've collected colostrum samples off over 1,200 Welsh ewes. We've made some quite we're working on at the moment, but actually looking at the quality of colostrum and tying it back to how ewes are being fed, that's such an important part of the sheep year. And then lambing, I'm going to talk a bit more about lambing, but those protocols, keeping lambs alive, best time of year. Everybody loves lambing, or not. It's busy time of year, but best time of year, and making sure we get lambs so we are selling them at the right price. Lameness, it doesn't matter how many conversations we have with farmers, it often comes round to lameness, and making sure we've got an ongoing plan. And sometimes it can be as much as going back into the flocks and going through everything again and again, and working out where on the whole 5-point plan are things letting us down. What is it that we haven't quite got in place, because as I'm quite sure anyone in this audience who has their own sheep has dealt with lame sheep. And if you haven't dealt with lame sheep, then please give us a ring, let us know how you do it. We know that lameness is something that we just need to keep tabs on, because once it gets out of control as an infectious disease, it can get out of control quite quickly, and it's difficult to just mental health is really hard when you've got a lame sheep. So it's something we get involved with a lot. We know parasites are a big thing in sheep, and whether that's worms, fluke, cocci, what to use, when to use it, which sheep, important. Vaccinations, ectoparasites, and then some sort of plan to make sure we don't bring disease into the flock. So as we build up this wall of how to make the flock robust, these are just the sort of headline places where vets really want to be involved proactively and make sure we've got everything in place for a robust flock. And we've coined these phrases, and actually we started using them in the sheep industry a couple of years ago: plan ahead, prevent disease, and protect the flock. And now through some of our antibiotic work, the other sectors are using the same, are fitting some of their programs around the same: plan, prevent, protect, but the sheep were there first. So I think Kevin's on the call, and I'm really glad I quoted you in this, Kevin. So this is a slide that we've used previously, but so I'm quite pleased I'm quoting Kevin's: "You look after the ewe, and she'll look after you." And there is no doubt wherever we are, and I suppose that people don't expect us as vets to primarily, nutrition is one of the biggest things we're into, and we really enjoy it. But actually, just today, I've been on farm. We've got a Challenge Sheep Partners meeting on at the moment. We've been all going through ewes, body condition scoring ewes, and checking each other against. We don't get the results till tomorrow to find out how far off we all are. But ewe body condition score is so important, and as we're feeding the ewe as she comes up, that do underpin anything. So we can have a fit and healthy flock. And then as we put on top of that the plan, prevent, protect, so we need to have plans and protocols. We need to be using testing, acting on results, and then taking decisions that are based on the risk, so that we can prevent problems. So we're minimizing those risks. So we've basically got everything in place: the shelter's right, the hygiene's right in the lambing shed. We're preventing unnecessary disease, and then we're protecting the flock by making sure neonates have good colostrum at the right time, quickly enough, and of good enough quality, and we're vaccinating older flock. And so we can target medicines appropriately and make sure we don't use medicines unnecessarily. So it brings me on to my second most favourite subject, which is responsible use of antibiotics. And why does it matter? So this picture of Alexander Fleming, he discovered penicillin back in the 1920s, and it's been available since 1941. So throughout my whole lifetime, and probably most of the people in this audience, we have been expected that if ourselves or one of our members of our family go into hospital, they will not have issues with bacterial conditions. And we expect the same on our farms. But we also know that selection for resistance is absolutely normal. So every single time we give a dose of antibiotics, we reduce the chance of it working as successfully next time. And bacteria, and to say this with parasitologists on the call, is they are really clever. They are actually the most clever in that they can have resistance in one bacteria and it can spread across to a different type of bacteria. And that's why it's really, really important. So it's not like in worms where you can get resistance in one population. With bacteria, you get resistance in say, an E. coli, and it can split into a different bacteria. They're that clever. So our only solution to this is either we discover more antibiotics, and quite frankly, if more antibiotics are discovered, there is no way anyone will be licensing them for animals. They will go in for human use. So actually we have to use what we have as carefully as we can. And that means not prophylactically, not inappropriately or as a mass treatment. And just to highlight that, this is the review of antimicrobial resistance by Jim O'Neill, and it shows that by 2050, we can expect human deaths from antimicrobial resistance to be in excess of 10 million. So actually massively dwarf, that's annual deaths. So that massively dwarfs our current pandemic, and that's less than 30 years hence from now. So my kids, I hope I'm still alive. My children will certainly still be alive, but global deaths of 10 million is really quite worrying. And sheep farms, it's really worrying as well. So it's not just a One Health human issue. This is some work that Jennifer in University of Liverpool, looking at susceptibility of E. coli on farms to antibiotics. So we look at these antibiotics here, over here, amoxicillin, that's Sinulox. This is amoxapen, Betamox. This is Baytril, Marbafloxacin. This is Spectam in Scourhawk. This is oxytetracyclines. These are antibiotics that you probably are aware of. Look at this on farm 9. They have resistance to almost all of these antibiotics. They cannot use an antibiotic for E. coli on that farm. That is really serious. And if you remember what I said, that bacteria can pass resistance to other bacteria, they're rapidly getting to a situation where they simply cannot use normal antibiotics, and they can't even use some of the critically important ones. So yeah, there's a variety there, but they didn't test a lot of farms. So we've got 6 shown there. You do not want to be in farm 4 or farm 9. There is no way back from that. So if you want your son, your grandson, your daughter, your granddaughter to be farming sheep on your farm, you really want antibiotics to still be working, and you do not want to get yourselves in those sort of situations. So what happens in your lambing shed? I'm sorry to anyone who's heard me talk about this. I almost kept these slides out because I thought I talk about this so often, but then it really is so important. Please don't be somebody who just gets on and doses or injects every lamb at birth. That is not a situation that we can cope with. And we go back to plan, prevent, protect. So here, planning ahead means making sure you have a plan for the lambing shed. Be speaking to your vet well before the end of the year, months before lambing starts, when things are not yet stressful, and make sure you've got your diet sorted out. Make sure you're doing what you can, that the ewes are going to be producing decent colostrum. Preventing means you do everything you can, whether you're lambing inside and everything's hygienic, whether you're outside, you've got good shelter, everything is clean, dry, plenty of fresh bedding, all the things we talk about all the time, and it really is going through it all with a fine tooth comb. You cannot be take too much attention to detail in terms of lambing time and preventing infection. And then as we look at the ewes and protect them, so that ewe has to be in good body condition score. She has to be fed well. She wants to be fully vaccinated. She wants to be sound. You do not want a shed full of lame sheep, because that increases bacterial. It weakens the ewes and it increases the number of bacteria. So she's got to be clean. And all of those combined together means she's more likely to produce good quality colostrum. And that is what is the most important thing in the lamb, particularly in preventing watery mouth and scours, but right through that will set the lamb up right through its life, because colostrum is gold. So if you are somebody who wants to dose or inject, so I haven't got my joint till slides here, the discussion is slightly different, but it's no less important. If you want to inject or dose all your lambs, you have got to change. And you need to be doing that by talking through with your vet, and you need to be talking with your vet in the next month or so. And it may be that you divide the flock. You're looking at high and low risk lambs. You target treatments, and you make sure. I'm not saying that you cannot treat anything with an antibiotic, but I am saying you definitely need a plan, and there is no way anybody should be thinking next lambing I'm going to start by treating all my lambs because that's what I do every year. You can't afford to do that every year. You have to have a plan in place and work with your vet, and it can be a gradual change, but some gradual change must take place. I've been so heartened in the last lambing season. Through January, I did about 14-15 meetings with groups of farmers, evening meetings in lambing time, and I was so heartened by the number of farmers who have started to make the change. So we used to have, and actually we used to sell 11.5 million oral doses of antibiotics a year for lambs, 11.5 million. We're now down to 5.7 million. It's still too many, but we've reduced it by 47% in the last 5 years, which is good. It's not about taking away a crutch or disappointing people. It's about working carefully with your vet, and vets get the same message. They know, they are really on it. They want to be working actively with you in flock health planning. They want to be building that relationship, and they want to be making a difference. So please do approach your vet and talk to them, and don't wait till you're desperate and you're lambing. So it is plan, prevent, protect, making sure we've got those essential principles. And it is about measuring and monitoring. So we have made huge progress in the sheep industry with antibiotic wise. We have got a lot of vets on board, and we have got lots and lots of sheep farmers on board, but we are really struggling to evidence it, to go back to government, to the VMD, to whoever needs to know and say, in the UK sheep industry, this is how much antibiotic we use, and it's really not a high amount. And we need to have those figures. So this is a bit of a plug for the Medicine Hub. The Medicine Hub has been available since January. HDB have put a lot of work into the Medicine Hub. And actually, we need to know exactly what antibiotics you've been using on your farms. And it's all anonymized. No one's going to be pointing the finger, but we really, really need this evidence. It's something that Phil and myself, the NSA, have been part of this. We've had pilot groups, but we've worked out that probably the best way to collect this data off farms is for farmers to be working with their vets. So please do talk with your vet. And if you're in Wales, you can put your data through Welsh lamb and beef producers, and it will get collated. If you're in England, Scotland, Northern Ireland, the Medicine Hub is definitely for you, and your vet is the best person to work with you. So go to them, and if they don't know about the Medicine Hub, tell them to get in touch with us, and we will tell them about it and help you put your medicines on there. So I'm just going to, this is my little flock that I just want to finish with. I'm not quite at the end yet of the view. I want to kind of just look at the risks for this flock. Okay, this is your flock of sheep, and they're all looking beautifully white and disease-free. And just think of these scenarios. So unfortunately, one of your neighbours often has sheep scab. Your neighbour on your other side, who doesn't generally get sheep scab often, but you share facilities. That's what this thing here is. You share facilities with them, which is sensible, except he happens to buy in a tub and it's got virulent foot rot, CODD, different strain to what you have on your farm, which is unfortunate. Your the third issue potentially is you buying in some replacement ewe lambs, and unbeknownst to you, they have enzootic abortion. And then the fourth scenario, this is a depressing load of scenarios, just to warn you all, I'm sorry. Yeah, you buy in a tub, and unfortunately he wasn't accredited, and he brings mydivisna or an iceberg disease into your flock. So just want to talk through each of these and just help you to realise how key it is that you're working with your vet, because within not very long, your lovely white flock of sheep has suddenly got all these different issues that you've now got to tackle. Actually, what I was saying at the start and the preventative is we really want to stop these issues happening before they do. But I'll just break them down, and I'm going to start with the sheep scab. So important to keep good fences. And like sheep scab, how many times have we been talking about sheep scab? It's so important to have good fences and to use the tools we have. And that we can blood test to check for sheep scab. We only need to test 12 sheep in any group of animals to indicate whether the flock is free from sheep scab or not. It's a brilliant tool, and you want to be asking your vets about it. Don't just think, I'll just go ahead and treat. You may not need to treat, and your blood test will help tell you why. And I'll just do a quick plug for our a survey that we've got out at the moment. Actually, if I will try when I stop speaking to put the link in the chat, so you can click on it. We've got over 600 sheep. The more people who put their attitudes into this survey, the better we can really start to gather reasons why we struggle so hard to deal with sheep scab. So I will put this in the chat after I finish speaking, and I'd really appreciate it if once webinars are finished, later tonight or tomorrow morning, please go and click through the survey. That will really, really help us. Okay, scenario 2, your neighbour buys in a tuck with virulent foot rot. This is an issue because you're sharing facilities with him. Make sure everything, if you are sharing kit, is clean, and that you're less likely to get problems. Any incoming sheep, they should be quarantined. That's a most common way to bring in virulent foot rot or CODD. And if the CODD there, the vaccination does not directly protect the sheep from CODD, but indirectly it does, because foot rot and CODD work together. So vaccinating is part of the protecting your flock. It's the one vaccine that farmers come back to me again and again and say, that's the best thing I did last year, because it's just given them a bit of space to get everything else right. So as we're talking about sheep lameness, the 5-point plan is a key. And so here's a 5-point plan. And because I was talking about antibiotics before, what is appropriate in terms of responsible lameness control? And it is absolutely always appropriate, if you've got a sheep that's lame with foot rot or CODD, is to use an injectable antibiotic. That is currently the appropriate thing to do. So, but we are also saying, please don't use too much antibiotics. So, and we know that lameness accounts for 2/3 of the antibiotics that we are using within our industry. So what the key message is, don't treat a clinically lame sheep with an antibiotic. The message is, don't allow that sheep to become lame in the first place. So plan ahead, prevent issues, and protect your flock by vaccinating, by going right round the 5-point plan. Please speak to your vet about it. It's much more than I can speak to in one slide, but we know there are large numbers of sheep in the UK who could be given a foot rot vaccine, and it would help. Potentially that comes into protect, but there are plenty of other things you can do. Quarantining people don't do well, people don't cull out lame sheep, and they don't treat quickly enough. So please speak to your vet about lameness if that's with you. That's all I'm going to say on lameness, because I'm rushing on through. And buying sheep with enzootic abortion is one of the other risks of this flock, and it's an important thing to speak about in terms of responsible antibiotic use. So we use Plan, Prevent, Protect again, looking at enzootic abortion. I suggest by now most people are pretty much set up, unless you're quite a late lammer and you still haven't yet got to vaccinate your flock. We're slightly late now if you're thinking that's something I need to do. It's got to be 4 weeks before tupping that you vaccinate your flock. But there's other key things in preventing enzootic abortion in your flock. And one of those is, be careful what you buy in. If you are buying in, you are always at risk of enzootic abortion, unless you've bought accredited, of which there aren't many flocks. If you have a ewe on your own farm who aborts, you need to isolate that ewe as quickly as possible. That's the best prevention you can do, is get that aborting ewe away from the rest of your pregnant ewes. And I would suggest, if you are buying in sheep, you should be vaccinating against enzootic abortion, because you just don't know when it comes in. And once it's in your flock, you are massively on the back foot. You are much, much better to start vaccinating your replacements before you ever see enzootic in your flock. Once you've got it, it's much harder to treat, and then you probably will have to use antibiotics for a year. Just, it is not acceptable to use antibiotics unless you're in the face of an outbreak or you've had it confirmed in the previous year. So don't plan to use antibiotics. Do plan ahead really carefully with your vet. Plan ahead, prevent unnecessary infection, and protect. For enzootic is appropriate, and for toxo for that matter, it is appropriate to have replacement ewes vaccinated. I'm rushing through this, and this is my last one, and actually, and I don't want to even start on too much, but if there are some really nasty diseases out, OPA, CLA, Johne's, Myelofibrosis, border disease. Just today I've listened to a case study of somebody who brought in some mule lambs with border disease and caused hideous issues in the flock. On here, I'm just going to talk very, very briefly about Myelofibrosis. It is a chronic disease which is massively increasing our flock. I come across flocks all the time, unfortunately, that have Myelofibrosis. So if you haven't got Myelofibrosis in your flock, you really, really, really do not want to buy it in. Can you please talk with your vet? Make sure you have a good plan in place. Make sure you only buy sheep from someone who regularly monitors for disease, and make sure you check your own flock, and that you can do that again. Blood sampling 12 older ewes, you can quickly pick up whether you've got Myelofibrosis. If you wait until you see signs, you've probably got half your flock infected by then. So it's a key, it's not just Myelofibrosis. There are other nasty iceberg diseases, but actually a close relationship with your vet is really important in dealing with these things. You could probably tell that I could keep talking for hours, and that's not fair on everyone else. But just quickly to summarize, you can't afford to be average in the world today in the sheep industry. Every cost you make's got to be an investment. The biggest threat to your own flock are other sheep, and that last illustration of that flock, whether it's your neighbours, whether it's sheep you buy in or bring into your flock, think about that. And your absolutely closest friend should be the vet. So use them. Make sure you're dealing with someone who is keen and interested in sheep. Get them to talk through, so you can plan ahead, protect issues in your flock. And just a second plug for the Medicine Hub, please help us to measure what antibiotics we're using, because we really, really need it to defend the industry, to say actually we're doing a really good job. Currently we don't have the data to prove that we are, and we need your help to demonstrate that to government. That's me, Phil.
Fiona, thank you very much. I'm sure you could talk all evening, and I'm sure there's plenty of people out there who would love to listen to you all evening as well. But as you say, we need to move on. But thank you very much. That was a great presentation and a really powerful plea and talk about antibiotics as well. One that is, I think, more people need to hear. I would say we've had people leave the National Sheep Association because they think that we're pushing them to a position where we should be using less antibiotics. But we need to get that message out to people, and that was delivered extremely powerfully, I think. The other thing just to mention there is, we hope in England, at least in the short term, that we will speed up the involvement of vets on sheep farms through the Pathway program, the Pathway Animal Health and Welfare program, and that will engage very closely with the Medicines Hub as well. So hopefully that'll drive a lot more data to the Medicines Hub. But thank you very much indeed. We haven't got much time, and Neresh, you're keeping an eye on questions. There were a few comments coming through in the chat and a few questions. There was one that was very specific that I wouldn't mind just asking you, and it's come from Heidi Jackson. Does using compost fertilizer from a council waste increase the risk of getting multi-resistant bacteria on the farm? And I guess you could include sewage sludge within that as well, possibly.
And would it increase the risk? It potentially, there's a huge amount that we just don't know. But it does. One of the reasons why we don't want people to use antibiotic foot baths is because so this isn't quite answering the question. But if you think about a massive foot bath, flooding it down the drains, antibiotics in the environment is something that is really scary. And so that we don't always know the link between, we do know that using antibiotics on a sheep farm is more likely to cause antibiotic resistance in the sheep, and using antibiotics in human population is more likely to cause antibiotics in the human population. But there is definitely also a crossover, and also with the environment. And the specific compost issue, I wouldn't say it's risk-free, but I wouldn't say that's it's like green waste for dairy cow. Yeah, it's not. It would nothing is risk-free, but I couldn't say absolutely this is the answer to that, Bill.
Okay, thank you. Well, if anyone hadn't driven to working more closely with our sheep vets after that, I don't know what is going to make them do so. So thank you very much, Fiona. Neris, are we okay to move on, or any other questions?
There are some questions which I'm collating, but I was just going to say it's worth mentioning to people that we're going to do questions at the end.
Yeah.
So hang in there, guys. We will get there. So don't switch off.
Great stuff. And as Yann said at the outset, try to put questions in the Q&A as far as you can. I know some are coming into the chat. Fine.
I'm crossing them over. It's fine.
Yeah, great. Okay, that's fine. So where are we going to go next? We're going to now hear from Dr. Fiona Kenyon. And Fiona, our second Fiona, gained a PhD studying sheep scab mites at Moredun. And we are blessed actually to have so many organisations and individuals working passionately on behalf of the sheep industry. So Moredun is one of those associations that I'd like to mention there. But Fiona studied sheep scab mites at Moredun before then completing a postdoctoral position at Edinburgh. She now works at Moredun on the management of anthelmintic resistance in sheep, currently interested in how different anthelmintic treatment strategies affect the development of resistance, and has been working on developing targeted treatment and targeted selected treatment strategies in sheep. So Fiona, very keen to hear what you've got to say, and I'll hand over to you.
Thanks very much, and I will just share my screen, which hopefully will work.
Yeah, that's working well.
It's almost working well. It's not letting me change to presentation mode. Right, one more try. Sorry.
That's all right. It's not a problem.
It's typical. It worked fine in the practice, but now that we're doing it live, it doesn't.
Would you like me to share it for you, Fiona?
Yeah, maybe. I mean, I'll stop sharing. It just doesn't want to go into presentation mode.
Okay, you just let me know when you want to move on.
I will.
Next slide.
Thanks,
Sorry about that, guys. Worked very well in the practice run. Since given up.
Is that okay?
Yep.
Brilliant.
Okay, so thanks very much for inviting me to talk here today. I'm going to talk about how we can use technology to try and improve animal health and welfare. So could I have the next slide, please? And I'm basically going to talk about a couple of projects that we have ongoing on the lab at the moment. And both are around using technology. And the first one is called Smartsheep, and it's all about using tools and technologies and trying to design tools that can help us to optimize worming treatments in sheep. And this builds on some of the work that we've done looking at if we can target treatments effectively towards lambs. And there's two main strands I'm going to talk about today. So first of all, it's how we've developed the dashboards and the tools that can be used, and then also a little bit about the validation that's going on farm, but that is very current, so there'll be a little bit. The Tech Care project is a second one. and that is looking at how we can use tools and technology to promote animal welfare and efficiency and improving health for sustainable small ruminant farming. And the workshop, so that one is involving workshops and discussion with industry to prioritise welfare issues and to find out what kind of tools people would like and how they would work. And then we're going to have a series of experiments looking to pilot testing some technologies that we think are, could be useful, prototyping things that are at a very early stage, and also then rolling out certain technologies in over 100 commercial farms across Europe. So this is a huge collaborative research project over 4 years with 19 partners. Could I have the next slide, please? So this was one of the first outputs from the Tech Care project. And this was from discussions with stakeholders about what are the kind of welfare issues for the UK flocks. And for meat sheep, we also have some dairy flocks in the European circuit, but the meat sheep, which is mostly outdoors, it's GI parasites that are one of the most important welfare issue as viewed by stakeholders, and then followed by lameness nutritional issues, mastitis, ectoparasites, and poor maternal relationship. And I'd like to touch on some of those things today, starting off with the ringworm parasites. So next slide, please. So as I'm sure all of you know, this is just a brief introduction, just to say that, parasites are ubiquitous infections in all grazing animals worldwide, and we can have multiple worm species as a common way for the infections to come about. We know that the annual costs of the UK industry of about £42 million per year split into lost production and also in treatment costs. And we know that infection affects productivity and carcass quality and lower values at sales. And usually it's subclinical disease. So you don't see the clinical signs, it kind of bubbles around under the surface, but that in itself will lead to reduced productivity and weight gains. Next slide, please. And what I'd like to talk about today is really the precision livestock farming. And the main way to think about that is using equipment or data or software, using any kind of information that you can get, which allows you to understand your animals at a more individual level, and then you can use that to target decisions or inputs or treatments more precisely. So essentially it's that. Next slide, please. You may be aware in the dairy and cattle industries that the precision livestock farming they're doing is using a variety of different tools. So they can use collars, they can use things called moo call that can tell you about calving times. They can be used for estrus detection, milk production, calving, health. And if you can click, please, then in the pig and poultry world, then they also have them for sheds. So it's not necessarily just wearable things that animals can wear, but it's also what we can do to monitor the environment to help improve productivity or health and welfare. Next click, please. And in sheep at the moment, we don't have that many, so the poor sheep's here, what about me? So hopefully we'll discuss what could be done. So next slide, please. So as you know, and as Phil introduced, I've been working on this idea of targeted selective treatments, which essentially means just treating individual underperforming lambs within the group, rather than treating all your animals or all your lambs at one time. And the idea behind this is to slow the development of antibiotic resistance, which Fiona introduced, antibiotic resistance. Antibiotic resistance is a similar idea. And we've developed this recipe or algorithm called the happy factor, and that tells us about the minimum weight prediction that an animal can do. And we can link it up with the on-farm technology to provide a pen-side decision support system. So what we'd like to do is just a wee reminder of why TST is important and can work. This is my slide that we have blue squiggles, you can use your imagination, are the susceptible parasites, and red worms are the resistant ones. So the green block here is our field, and you can see there's a mixture of susceptible resistance, and that's reflected within the animals. Next click, please. When we treat with anthelmintics, then we remove the susceptible worms from the animal, leaving only the resistant ones. Next click. And when they pass the eggs out, it's only the eggs from the resistant parasites that are being passed from those treated animals if they have worms that survived. And that's compared with animals that are untreated that are still passing out this mixture of susceptible and resistance. And what happens over time is if we treat all the animals or most of the animals at one time with the drugs, then we are going to increase the numbers of resistant parasites that go out onto pasture. So we want to try and reduce that so that we can dilute out the resistant parasites. So that's a quick reminder of the theory of TST. So next slide, please. So we have used the algorithm that I mentioned that allows us to predict minimum weight gain, and we've run it in trials over about 7 or 8 years on the Moredun farm. And we have compared it with other commonly used treatment strategies. So we've looked at comparing it with monthly treated animals, where we treat all of them every month. We have the TST, where we treat just the individuals that cannot reach this minimum weight gain target. We have targeted treatments where we treat at weaning and 6 weeks post-weaning, and that's because we understand the epidemiology of the parasites that we work with. And finally, we allow some animals to become clinically ill. And you can see that the mean number of treatments, antibiotic treatments given per animal in the monthly treatment is 4, and we use half or less than that in the other treatment groups. And you'll see for the first 3 treatments on that thing, there's no difference between the production of those animals. So we're wasting half of the treatments that we give to the monthly treatment group because we're not getting a production benefit from it. Okay, so we don't need to use them. If we wait till animals become ill, then of course we use less wormer, but we see that there's a penalty because the mean growth is significantly less than the others. And also there's a penalty in greenhouse gas emissions, which is significantly higher than the others. So we've looked at this on a range of different small numbers of commercial farms and different breeds, and essentially we find the same thing, that we can reduce treatments by about 40 to 50% with no effect on animal production. Next slide, please. What does it do in the development of antibiotic resistance? So this graph is showing you how the drug efficacy changed over time. And when the drugs are working well, as I'm sure you know, the efficacy should be above 95%, so it should be working very well, which it was at the beginning of the trial in 2006. As we moved on, you can see all of the treatment strategies reduced the drug efficacy, and that's because we were using the drugs, as Fiona's already mentioned. But you can see the monthly treated group, the purple line, has a significant and persistent reduction in efficacy over time. The others maintain it better with varying drops at varying points, but the little red line there for the TST group kind of optimises it most overall. Next slide, please. So we know that TST can slow the development of antibiotic resistance, and also it can help us with labour costs. So this is work that we did in conjunction with SRUC up at their Kirkton Hill and Livestock Farm, Hill and Mountain Research Centre, sorry, and they compared a conventional treatment strategies where they had their animals that were treated on the basis of fecal egg counts and using normal weight rates and things, compared to our TST strategy and using an automatic weighing and shedding machine. And by doing that, they reduced their worming costs from £70 to 13. They reduced the number of hours required to do things. They reduced the labour costs significantly as well, all meaning that the costs were reduced by £1.60 a lamb, which kind of feeds into what Fiona's saying again of trying to, think about the costs and where you can make savings. Next slide, please. So just to summarise that, the TST approach can optimise wormer use, it can slow the development of resistance, it can reduce labour costs and reduce treatment costs. Next slide. So that's great, that's a win-win situation, and it'd be brilliant if we could get more farmers using it. But at the moment, there's quite a lot of barriers to that. We're working these algorithms or the recipes in-house, the calculations at Moredun. So of course, that's not something that can be built up and spread out to farmers very easily. So we need an easy and user-friendly way for farmers to access the technology. We need validation on more commercial farms and a range of farming systems and across the UK. And I think we also need evidence of how the system works at a practical level to kind of show the evidence of why, if this is a good idea. Next slide, please. So this is where our Smartsheep project comes in. So we are working in a way that we have a group of focus farmers, focus farm advisors. So we have 5 Agri, a farm advisory business, consultancy business. We have Leslie Stubbin Sheep Consultancy, Synergy Farm Vets, there's Synergy Farm Health, and Elanco. And each of these people have a number of focus farms that they work with that are taking part in the project. And you can see them spread throughout the UK. And in the purple dots are the 2 research farms that are also running the trials, and that's Moredun near Edinburgh, and then the Hill and Mountain Research Centre up in the Highlands. Next slide, please. And this is just a quick slide to give you an overview of what the farms are that we're working with. So we've got a variety of different breed types, some of them that are very commonly used in the UK sheep industry. And we also have a good variety of size of farms, ranging from animals, sheep numbers less than 600 to over 2,500, and they're all on different farming systems, so hill to lowland creep feeding. Next slide, please. And essentially, what we'd like to try and do here is, with the help of our innovative farmers and our farm advisors, who are crucial to the project, is to be able to have advice from them about how we should display the information and how it should work. So that's taking this TST algorithm and making a grass monitoring app and making a dashboard that's user-friendly and intuitive. And then we want to test that on a range of commercial farms, on the 16 farms that we've talked about. And we're looking at how the dashboard and the TST works. We're looking at what worm burden and species data that we can get. And we're also going to look to do an economic and carbon analysis on the different farms. Next slide, please. Now, I'm just going to show you some of the dashboard that we've done. You'll appreciate that because the trials are still ongoing at the moment, we don't have many results to show you across the different farms, but I'd like to spend a little bit of time looking at this. So this is the first page of the dashboard. This is our farm at Moredun. You can see there that we have the fields that are Moredun are highlighted in light green. So that's all the fields that we can see. We can zoom in and out from that. We have a block of animals needing attention. So this is animals that haven't reached that minimum weight gain target, and we need to look at them. And if we go to the next slide, please. And we can also look at lamb performance over time. Excuse the wiggly graph, that was me playing about with some data, but essentially you can see how your animals are performing over time. And we can also have a summary of the groups. How many animals in the group? You can have multiple different groups there. Next slide, please. And this is how we can record grass. So we still need to know if animals have been exposed to, if grass is at all limiting how much is available, so that we can work out the grass. But you can see that we've got animals here with the field that's kind of red shaded with little green sheep. That's the field that the animals are in. On the left-hand side, I've got a range of the groups where they've been across the farm. And I can either input that information along the bottom on the desktop system, or I can use a mobile phone app, which is the little block to the right of my screen, which might be the left of yours. So sorry if I've got that the wrong way around. But so we have the opportunity to use either a mobile app or a desktop app to do that. Next slide, please. And essentially, once we've inputted animals' EID and weight and some idea about the food, then we can just click on this box, download the true test, and we can then download our file of the treatments, the target weights for each animal. Next slide, please. Once we've weighed all our animals against our target weight, then we can also record the treatments that were given to the animals over time. So essentially, you can see the animals that were recorded, you can tick the boxes, and then you can input which drug that were used, and that gives you a record of when the animals were treated at individual times over the course of the season. Next slide, please. So this is just a kind of a short diagram to show how the system would work in practice. So as I said, you need to collect weight and EID from your animals and upload that into the AgriIgnite system. You'd measure grass, or at least check that it's not limiting, and record that in the app or on the AgriIgnite system. And then you can download your target weight file, put that into your weighhead, run your animals through. We've got drafting codes that you can draft on the basis of if they've hit their target weight or not. If you have automatic shedding facilities, you can have them working, and if not, you can just collect the animals into groups or treat them in the crate when you're working. And that would be the circle that you go around each time that you're doing it. At the moment, we're collecting fecal samples to look at egg counts and species ID, but on a you know, a normal system, you wouldn't need to do that, and you would be able to do that by yourself. Next slide. So our on-farm tests are underway, as I've said before. Now, we've had plenty of teething problems, as I'm sure you can imagine, working with technology on farm. And most of these have been due to technological connectivity, or, you know, devices not talking properly to each other. But there's been some issues on data format, for example, EID tag numbers being recorded differently on different EI tag readers and being uploaded differently, and then, you know, systems working or not with that. So I think that some of these things we've been able to sort with our software, but some of them I think are more of an industry-wide issue. And I think it's something that industry, as in general, could benefit from thinking about how we can make sure that making systems as simple as possible so that everything talks to each other and works is, I think, where we need to be. And that will allow us to gain benefits from the technology that the technology offers. So on a positive note, though, despite this, the approach is now working on the 16 farms, and we're collecting lots of data that I hope to be able to update about at some other stage. So I'd just like to go on to the next slide. That section of the talk was kind of a PLF tool that's kind of almost ready to be available to farmers. And this is now a look into the future of what we could do. So it's identifying technology that can be useful to monitor health and welfare in grazing animals. And just to point out, it's going to be, we're thinking of this as a tool to help people. It's not to replace people. You know, we're not expecting that the tool will just do everything for you. It's to be able to give you an early warning. And I think, as Fiona was saying earlier, you know, if you can identify problems or prevent problems from happening, then that maintains the productivity, the health, the welfare of your flock easier than allowing things to develop and then having to fix them. Next slide, please. So the idea behind these is trying to find practical measures that can work on farm. But what we also want to do is look at how we can use these technologies to identify various problems. For example, worm infections, mastitis, lameness. And we've been doing some experiments at Moredun over the last year. And what we're trying to do is bring together lots of different areas of information to try and see if we can train or understand what and make the technology work for us. So, for example, we've been doing studies where we've looked at controlled worm burdens on animals. So we've allowed them to be naturally infected, and we've treated some so that we know that they're low, and allowed some to become more clinically diseased, so that we look at what the behavioural differences are. Because there's very few written papers, you would not probably believe, but there's very few written papers on the behavioural changes in sheep due to a worm infection. And of course, technology would be looking at picking up potentially behavioural changes. So looking to identify that question, looking at what welfare indicators are out there and how they, you know, how the animals will score on that, and clinical observations such as egg counts, weight gains, things like that. And also the technology, so electronic ID with weigh crates, accelerometers, and contact loggers. Next slide, please. And some of the research questions that we're interested in is, you know, how does the level of worm infection present affect sheep behaviour? And if we see differences, when does that behavioural difference arise? And could those behavioural differences be picked up by the technology and act as an early warning system? And does the use of PLF itself cause any welfare issues? Next slide, please. And to do this, we've been working this year in a kind of pilot trial with 24 ewes and their 48 twin lambs split over these 4 treatment groups. So we have animals that are either wearing technology or not, and with low parasitism or high parasitism, to be able to answer these questions. Next slide, please. And we're interested in looking at various stages of the animal's life. If you remember right back to the beginning of the welfare issues that were important, worms was a problem, mastitis was a problem, lameness was a problem. Ewe lamb bond. So we're hoping to hit these by looking at various stages of animals as they go through their life. So in early life, the ewe lamb bond, when nematovirus infections come, could we identify that earlier, and mastitis. And then at weaning time, mastitis in the ewes and lameness in both groups, and worms, and again in post-weaning, worms, lameness, which would only be in lambs at post-weaning. And along the bottom, I've just showed you some of the technology that we're using. So the white box with the kind of little blue thing beside it, that's a GPS unit. It's tiny, and animals can, you know, so we can have that as a wearable thing for animals. We also got the white triangle is a proximity logger or a contact logger that'll tell you how close animals are to each other. And the little black box is an activity monitor or an accelerometer. Now we realise that this is a research tool at the moment, so we wouldn't be expecting farmers to be putting this together on their animals, but for us to be able to see these different technologies and how they work, there's just some examples there of a lamb wearing a little collar that would have the white beacon and the black activity monitor, and then yows wearing what are actually running belts, but appear to be quite a comfortable way for the animals to wear a GPS unit with these other units as well. And the grey box is the reader that would record the activity. So these beacons basically say, I'm here, and the grey box that's on the fence post records and says, ah, you're over there or you're this far away. And from that, we can build up a picture of what the animals are doing. Next slide, please. And as I said, we've just finished that experiment in October, so we are analysing the data, but I thought it was interesting to give you an idea of what we're doing. So just to summarise, the ideas of precision livestock farming tools could be a powerful tool to help address health and welfare issues. I think we're kind of at the beginning of the journey at the moment to see how we can go. Approaches for optimising wormer use have been tested on commercial farms at the moment, with a view to moving forward with that relatively soon. I think for the future, other technologies are showing promise, but I think as with everything, we need to think of costs, longevity, robustness, and what the information is actually useful for. And I also think that industry in general needs to have a joined up thinking approach of how we can get all of these bits of technology to work together and work easily. And my last slide, please. It's just a plug for anybody that is interested in technology and how we can use it on farm and if it's useful or not, is to consider joining a final project that we have called Small Ruminant Technologies. It's a networking grant from the EU, and it's a way to share experiences on developments of new technologies and be able to use digital experimental farms or digifarms as a meeting and demonstration place. So we have digifarms in the UK. We're looking for people that are interested and would like to come and join us. You know, you get lots of different experiences and discuss them with a Europe-wide group. So if anyone is interested, there's some contacts there that I can also put in the chat if you want, if anyone would love, you know, if anybody's interested in that. And I'd just like to finish off saying thanks. There's quite a huge number of people to say thank you to on the next slide. Maybe it's coming. So basically the groups with 5Agri and Nighthawk Software, Synergy Farm Health, Leslie Stubbins, Elanco and Data Mars are all parts of the Smartsheep project, and of course our focus farmers are the main ones. Unfortunately, I can't show you any pictures of focus farms because the entire project so far has been run online because of COVID. We also have people in the Moredun Research Institute and at SREC, and we've obtained some funding. So thanks very much.
Great. Thank you, Fiona. There was a lot of information in there, and we often look at the sheep sector, or for years we've looked at the sheep sector as being very traditional, and when all the talk goes on about the use of technology innovation, we struggle to see where it could be applicable, but there's some great examples there, and you know, really appropriate technology being explored there too. So thank you very much. And you know, as ever, we're always delighted to work in partnership with Moredun. It's great to have you as or us working together as partners. So thank you for joining us this evening.
Yeah, no problem.
So, as Neri said, we're going to store the questions up until we finish. So we'll move straight on to our third and final speaker this evening. I'd like to welcome Eleanor Sanger, and Eleanor is here on behalf of the Farm Safety Foundation. As we said earlier on, you know, we can't really have healthy and welfare-friendly and profitable sheep unless our farmers and shepherds are in a similar state of mind and bodily condition, I guess. And the Farm Safety Foundation is an award-winning charity dedicated to support the physical and mental well-being of UK's farmers. The ultimate aim of the foundation is to have 0 avoidable deaths on our farms. We'd all love to achieve that, wouldn't we? And to achieve that, the foundation works very closely with partners in the industry to engage, educate, and communicate strong and relatable farm safety messages. So Eleanor, I'll pass over to you.
Brilliant, thank you very much. I'll just try and share my screen. Let's see. There we go. So I hope
Yeah, that's
working.
perfect.
Brilliant.
That's good.
Cool, thank you very much. So as has been already said, I'm Eleanor from the Farm Safety Foundation. We were set up by NFU Mutual, but we are an independent charity, and we are all about raising awareness of farm safety, particularly among younger farmers, so those aged 16 to 40, people who are just starting to come into the industry. Although we're based in Warwickshire, we do work across the whole of the UK, and we're basically all about supporting the physical and mental well-being of the next generation of farmers, because we want them to go into the industry and challenge and change the risk-taking behaviours that do give farming the poorest safety record of any occupation in the UK. So as you can see from our logo there at the top of the screen, we are represented by a pair of Yellow Wellies, so you might have heard of us as that as well. And we also have here our two big campaigns. So every year we run Farm Safety Week, which is obviously around the farm safety side of things. And we also do Mind Your Head, which is a big campaign about mental health in the industry as well. We work across 4 main work streams. So education is how we reach these young farmers. We train farmers in agricultural colleges across the country. And we also work with the YFCs at club level to reach young farmers there, and to date we've actually trained 15,000 young farmers in everything to do with farm safety and mental health. Engagement is really all about building relationships within the industry, working with other organisations and individuals who are really passionate about the same causes that we are. Communication, so I mentioned our 2 big campaigns, but we are working on this every day of the year. It's not just those 2 weeks. We work across press, PR, social media to really get our message out there. And then we carry out research every year as well, just to make sure that we're focusing on the right areas and to really see what's most important to young farmers in the industry at that time. So this slide really gives a bit of an indication as to why this is such an important issue. So across the whole of the UK, there are just under 500,000 people who work in agriculture. So it only makes up around 1% of the working population. But it does account for nearly 1/4 of all deaths in the workplace, which is really staggering that there's that disparity between the number of people in the industry and the number of deaths that actually take place here. So in the last year, these are our key figures. There were 34 farm workers who very sadly lost their lives at work. And there were also 7 members of the public, which really sadly did include 2 children. This is the only industry where children continue to lose their lives on a regular basis. Doesn't happen in manufacturing, in construction, but for some reason it does still happen in farming. So these figures are why we really want to do something about this industry. So this slide just breaks down some of the headlines from the report. So by age, we can see that more than half of the workers who were killed in the last year were aged 60 or over. But there were also 3 deaths in people aged under 40, so people aged 19, 20 and 27. So it really does affect obviously everybody in the industry, regardless of how old they are. Most people were self-employed. And as we can see at the bottom, it's not just the deaths that we're interested in, it's also the long-term effects of things like serious farm incidents. So we had 12,000 workers who suffered a serious injury in the last year, which is a huge number, and also 13,000 who have gone to suffer long-term ill health. So you can see from that that the effects of things like poor farm safety or incidents on a farm aren't just deaths, they're also long-term health problems that can result from this kind of thing as well. This slide breaks down the causes of deaths in the last year, and the really important thing to see from this slide is that actually these causes have not changed in the last 50, 60 years. It's always the same things, and the only thing that's different is actually the introduction of ATVs. So obviously these are a more recent development. That's the only thing that's different. So you can see that the highest cause of death in the last year was being struck by a moving vehicle. So this is a really big one in the industry. But livestock is really big as well. So 11 people were killed by being injured by an animal. And there were also significant numbers who were killed by contact with machinery, being struck by an object or a fall from height. And you know, again, as I said, these are often the big risk factors and the big causes that we see in these death figures. And as you can also see on the right, this is the highest number of deaths that have been recorded in the last 5 years. So sadly, this isn't a problem that's going away at the minute, and we really need to do something about that. So this slide just breaks it down into regions. So as you can see, there are high figures across the board. And particularly if we look at the southeast, we can see 2 deaths last year took place here, and there is a 5-year average of 2 deaths as well. So although that isn't the highest, you know, see the southwest, you know, 8 deaths last year, that's a huge number. It's not that high, but every death that could be prevented is a tragedy, and it's something that it's really important to try and bring down as soon as we can. So why do we need farm safety? Well, firstly, legally, it is the law, both criminal and civil. There's a moral aspect as well. We don't want to be the reason that someone close to us loses a limb or even their life, especially if we could have spoken up or prevented it. And there's also a lot of financial implications as well. So there are things like fines. The HSE will charge fees for intervention if they have to carry out an investigation. There's things like prosecution, having to bring in extra staff, carry out repairs, and then things to do with insurance and bad publicity as well. So lots of very different aspects of a farm accident that perhaps aren't even just the physical side of it. There's lots of other implications as well. So if we go back to the legal side of things to start with, we do have the Health and Safety at Work Act 1974. So as part of this, you do have rights in the workplace. So your employer must provide you with a safe place to work, safe environment and equipment, safe systems of work, and information, instruction, training and supervision. But what many people aren't actually aware of is that as part of this act, you do also have responsibilities. So as an employee, you have a responsibility to take reasonable care of yourself and others, to cooperate with your employer, but really crucially, the most important thing here is only if it is safe to do so, and to also not interfere with safety equipment. So we're going to just break down some of the main causes of death and just give you a bit of an idea of ways in which these could be prevented or avoided. So as we can see in the last year, moving vehicles did account for 1/3 of all deaths. So that's anything from tractors to telehandlers, lots of different types of moving vehicle on the farm that can cause accidents that can be fatal. And one thing that many of these accidents have in common is the victim not using safe stop. So if there's anything that you take away from this, we would love you to make sure that you always put in place safe stop if you ever need to stop a vehicle. So that's if you're checking equipment, carrying out maintenance, clearing a blockage, anything like that. Firstly, to fully apply the handbrake, to put all of the controls in neutral, to stop the engine, and to remove the key from the ignition. Because if there's no power in that vehicle, there is much less risk that you're going to be involved in an accident with it. As I said before, ATVs did also account for 6 deaths in the last year, and it is the way it's handled that makes it dangerous. So as you can see from the picture, there isn't anything on an ATV that's going to protect you if it does overturn. And often they're being driven across quite uneven ground. It might be hilly, there might be a lot of bumps to go over, and it can really easily overturn, especially at high speeds. So as there isn't a roll bar or a cab or anything like that, what you're wearing is your only protection. So you really must wear a helmet, because that honestly could make the difference. And you really do need to familiarise yourself with safe driving practices and prevent anyone under the age of 16 from driving it in any circumstances, because it's actually against the law. So everyone who is driving an ATV must be officially trained or be having training. So you can do this through courses such as Easy ATV or Lantra offer these as well. Always think about whether you do wear a helmet and PPE. If not, why not? It's a really simple thing to do, and it honestly could, you know, save your life. Not to beat around the bush here, it really could make the difference. Remember to always carry out a pre-start check as well, and plan your route and check ground stability, because as I mentioned, that can make quite a difference as well. Passengers and animals aren't allowed to travel on an ATV, so if there's one seat, there should be one person on it and no passengers. Always ride at a safe speed and make sure you know your limits. So 6 farm workers were killed by machinery in the last year, and on the right here we have Jim Chapman, who is one of our charity trustees. As you can see, Jim lost his arm in an incident with a PTO when he was just 23 years old. And again, this takes us back to the long-term effects of farm accidents, because although Jim hasn't lost his life, he's been left with the result, which is the physical effect of only having one arm. And he's also been left with some quite significant long-term mental health problems as well. So it really can have a very long-lasting effect if people are involved in an accident with things like machinery. So to try and prevent an incident, always plan your job beforehand and make sure that everything like PTO guards and shields are in place before you get started. Never remove or modify a guard to save time, and only use a machine if you know how to use it and you've received suitable training. Always read the instructions that go with the machine, and remember that a machine doesn't have a brain, so you really do need to use your own, because even a second of lost concentration can cost you your life. So overhead power lines are found all over the countryside, but it's so important that you're aware of where they are and that you always assume that they're live. So never touch or get close to them. And if they have fallen or become damaged, make sure you keep 5 meters away, because as it says at the bottom, at high voltage, electricity can actually jump gaps. So even just getting too close can be really dangerous. And actually damaged lines can stay live or be re-energized automatically or remotely. And you might not even be aware that this has happened, because if the network operator isn't aware of an incident, they'll just switch it back on. So it's really important that you stay as far away as possible and bear in mind that they could become live without you knowing. So if you have come into contact with a power line and the machine that you're in can't be driven clear of the line, the most important thing to remember is to just stay in the cab, because at that point it is the safest place. You should phone the network operator on 105 so that they can turn the electricity off in that location, and make sure that no one outside the vehicle approaches it either, because obviously they're at risk as well from electrocution. And do not exit the cab until you've been given confirmation that it's safe to do so. If it can't be driven free, but there are other hazards at risk, so perhaps a fire or something in the cab, if you do have to get off the vehicle, then make sure you jump clear and make leaping strides so that 1 foot is off the ground at all times until you're at least 5 meters away. Don't return to the vehicle until you've been told that it's safe. And again, keep others away as well, because touching it or getting too close could kill them. 3 people in the last year died from falling from height, and most accidents involving falls from height often happen because the work's not been properly planned. People don't really recognise the risks, and therefore proper precautions aren't taken or the wrong equipment is used. So there's an established 4-point plan for trying to deal with this problem and avoid issues to do with falls. So firstly, it's just to avoid the work if at all possible. So consider using specialist contractors instead. If that isn't possible, then you really need to plan the task properly and make sure that you're using safe equipment. And actually preventing a fall is the best option. So make sure you've got good edge protection rather than just putting in place things like harnesses or soft landing systems. And also any employees who need to work at height should be properly trained. So as I mentioned earlier, 11 people did lose their lives as a result of coming into contact with livestock in the last year. And the 5 members of the public who lost their lives did die as a result of livestock as well. So this is an issue both for you on your own farm, but also anyone else, a member of the public who might be crossing your land, if there's a footpath, for example, things like that. And although obviously in most cases, so all of those deaths were as a result of cows and bulls, actually there can be a risk from sheep as well. So it's really important to take the time to understand the behaviour of the animals that you're working with and make sure that they're handled by trained and agile workers. So we've said here, no children. We do have a story on our website about a female farmer who actually brought her child into a field during lambing because the child wanted to see what's going on. And while her back was turned, she was busy. Her child actually did get knocked over by a sheep. because obviously a sheep has the same kind of maternal instinct as any newly calved cow. And if you think about the sort of size in relation to a small child and a sheep, it's not really any different to an adult human and a cow. So that could have actually ended really badly, and it's so important to bear in mind that sheep will react in a protective way if they feel threatened. So you really do need to be aware when there are children on the farm as well. Make sure that there are safety measures in place and you've planned an escape route. Be particularly careful around cows and ewes with newborns. And if you are dealing with cows, never turn your back on a cow following calving. So if there's been an accident on your farm and you're the first on the scene, what is the first thing that you would do? So you'd maybe assess what's happened, think about how many casualties there are. But the very first thing you must always do is ensure your own safety first. So this means never entering an area that would put you in danger. So things like slurry lagoons, bullpens, because if you're at risk or even injured, you're no help to anybody. So you really need to make sure, first of all, that you're safe and you're not going to be put in danger as well. Make sure you carry out safe stop. So make sure engines are turned off and the keys have been removed from the ignition, and remove or fence off livestock as well so that they won't be involved in what's going on. So then you might want to make the call. So you'll call 999 112, which is the European emergency number, or 105 if it's an electrical problem, to alert the emergency services or the power network. Or you could ask bystanders for help or to make the call for you if you're not capable or you're doing something else at the time, like helping the person. Clearly explain the nature of the incident. So if you explain what's happened as clearly as you can, this will prioritise both the type and the speed of the responder. And make sure you always use the words farm accident, because that means you'll be prioritised. They'll be aware that this is probably serious, potentially even life-threatening, and they'll react accordingly and come to you as quickly as possible. And again, please make sure that you do make it clear if it's slurry related, because the emergency services will need special equipment like breathing apparatus to deal with an accident involving this. One other thing to think about having on your phone, just in case of an accident, is the app What 3 Words. So you can download this app to any smartphone. They've divided the whole planet into a grid of 3 meter squares, and each one has a unique 3-word address. And the emergency services generally do know how to use this, and they will use it to try and find you. So if you can give them your exact location, it's much easier than trying to describe where you are if you're in a really remote location. And it should mean that the emergency services can get to you much quicker, because they can pinpoint your location instead of trying to sort of drive around the countryside and work out where you are. We do have some more useful resources about all of these topics on our website, yellowwellies.org. So we have resource pages which are mobile friendly that you can just look up anytime when you're out and about if you need a quick reminder. And we also have a farm emergency plan. So this is a really useful document where you can just put together all of the information that you might need in the case of an accident on your farm. So you've got it all in one place, and it's really easy to find. You're not rushing around trying to find phone numbers or contact details. It's all there ready to go, just in case the worst should happen. So as I mentioned earlier about Jim Chapman, who obviously has suffered both physically and mentally when it comes to being involved in a farm accident, farm safety and mental health are so interlinked. They really do affect each other a huge amount. And although farmers are so good at looking after livestock, crops, machinery, they're not always quite so good at looking after themselves. So this is why we always want to mention to you mental health as well as farm safety, because they really are so interlinked. So there are a number of stresses, particularly in farming, that can lead to people being slightly more at risk of suffering from mental health problems. Things like, the weather. Everything's so dependent on the weather, and you can't do anything about it. Lots of financial issues like loans and debt. International trade agreements, politics, Brexit, everything that's going on at the minute obviously really increases stress. Rural isolation as well. So often you might be in a very isolated location and there might not be many people close by that you can talk to. And if your workplace is where you live, there's just no escape. You can't get away. And obviously farming really is a 24/7, 365-day job. It's not something you can leave behind at the end of the working week. So often it's just really hard to get a break, and everything might just end up getting a bit too much. So the Big Farming survey that was carried out by the RABI recently did show that 36% of the farming community are probably or possibly depressed, which is a really significant number. You know, a third of farmers are potentially depressed. And this is also something that's particularly seen in women. So 58% of women experience mild, moderate or severe anxiety. So as you can see from these figures, it is a really serious problem within the industry. We go back here to the original figure I gave, which is 34 farm worker deaths in the last year. But beneath that, we have 44, which is the number of suicides that were registered in Britain in 2020 amongst those working in farming and agriculture, which again is an incredibly sad figure that, you know, even more than the number of deaths from things like accidents, there were a significant number of people working in farming who tragically did take their own lives. And that's quite a crude way of looking at things like the prevalence of poor mental health in the industry, but it does give you a bit of an idea of quite how prevalent it is. And the other thing to note here is that of those 34 farm worker deaths, we can't know how many of them were related or due to farmers having poor mental health and potentially, you know, their mind being on other things or perhaps taking more risks than usual. So it really can come into play in that respect as well. We do have some useful resources on our website, which we really hope you'd find useful if you were suffering from poor mental health at any time. So we have the little book of Minding Your Head, which we've put together, which gives you a bit of an overview of a number of different mental health problems. And it gives you some ideas of how to find help. So ways of helping yourself and starting a conversation with someone who might need a bit of support. And there's also the directory of farm and rural support groups, which will help to signpost you to local and national organisations that can help with either specific issues or just generally if you need someone to talk to. Speaking of which, there is Farming Help, which is a helpline operated by FCN. Obviously, it is a farming helpline, so the people who are there to answer calls know all about the issues that face people in the industry. So they're really well placed to be able to point you in the direction of support for any particular problem that you're going through. And at the bottom, we also have the other farming charities, all working in different areas on different things, and they're all really geared up to help with any kind of struggles or problems that you're dealing with as well. And of course, outside that, there is the Samaritans as well. So we'd always recommend just giving them a call on 116 123. If you do find yourself struggling at any point, you can call for free, and it is a 24/7 number. So farming is also 24/7, and if it's the middle of the night and you really need someone to talk to you, they'll be there. But also they are available on email as well. So there's more information on our website, but if you'd rather not speak and you'd rather type it out instead, you can do that as well. So thank you very much for listening to me today. I hope that there's been some useful information in there. As I mentioned, there is more information available on our website, which is just there on the screen, yellowwellies.org. And we're also available as at Yellow Wellies UK on Instagram, Facebook and Twitter. So feel free to give us a follow and see what we're up to. And please feel free to ask any questions you might have. Thank you very much.
Thank you, Anna. Some really, really sobering messages there and a lot of good information contained. And there is something wonderful, isn't there, about family farms and, you know, families living up in the place of work. And there's lots of us amongst us, I guess, it would have loved the childhood of you know, being born and growing up on a farm. But it does bring its dangers and it brings its risks. And I thought, as you were saying, that Fiona's slogan of protect, plan and prevent is just as applicable to your subject as it is to sheep health as well. It's something we should all be doing, really. But thank you very much. That was a great great presentation from all speakers. Neris, you've been busy beavering away, I think, keeping an eye on questions and comments. Would you like to, is there any particular area you'd like to lead on?
Yeah, well, it's been great because both Fionas have actually been typing away as well to some of the answers, because I think we realised after the first speaker that we had so many questions we were never going to get round to everybody. But I don't know if both Fionas are there. Let me just double check. Yeah, so I'm just going to lead on a couple of ones with Fiona Lovatt. There was quite a few about foot rot vaccination timing. So I don't know if you want to just summarise those, Fiona, in terms of are the times where we can't do it and better times that we can do it. And then there was just a question about shearing as well. So if that would answer three questions in one. So
yeah, so with foot vax, on the data sheet, they advise you don't do it 4 weeks before or after lambing, so at the point of lambing. Foot vax isn't like the other vaccines in that it will last for a few months after you've given the dose, and you do not have to give your first 2 doses 6 weeks apart like you do, for example, with Heptavac. So we would always advise giving it just within 3 months before you're at the most high risk. So a lot of people have a lot of lameness, either as they're going into wet grass at the back end, or as you're going into the lambing shed or housing them. And so if you can, so I would suggest doing it any time from through the summer, from weaning, pre-tupping, or at scanning. And we'd usually suggest do 2 doses in the first year, but as I said, they don't have to be 6 weeks apart. So either of those times, you can get a lump with foot vax. You're less likely to get a lump if the vaccine is at body temperature when you give it. So just have it in your pocket, don't have it on a really cold day and give it really cold. And you don't want to you've got to give it under the skin, and you've got to do it really carefully. It's not a job to do as quickly as possible in wet or dirty sheep. So be really careful doing the jab. And that's why a lot of people will say not before clipping it, in case you've got nasty lumps that then, or showing sheep if you don't want unsightly lumps on them. So time it after clipping or shows generally. And
it's okay to give while pregnant.
It's fine to give when pregnant, but just at that very last stage, just because they're much less immunocompetent in their very late pregnancy, and it's just they've got a load else going on, and there's no advantage giving foot vax at the last minute, whereas they need to be concentrating on making colostrum and last minute.
Yeah, another interesting question was about on-farm medicine use, and sort of recording what was used is quite tricky. Could we not use annual sales data on a farm level instead? And I thought that was quite an interesting question that you might want to answer. Totally,
that's absolutely fine. If you want to go to the practice and or go through your bills and work out that you've used 3 bottles of amoxicillin and 6 bottles of oxytetracycline, whatever it is, total what you've bought. It's not as detailed as individual treatments, but quite frankly, it gives us it gives us better data than we've currently got. So I am quite happy to go with your annual, what you purchase in antibiotics is fine. And obviously, if you've got cattle and sheep on the farm, you try and split those as accurately as possible. That's the only downside if you've got mixed enterprises, isn't it, really? Yeah, and we're really advising vets to sell the antibiotics to specific enterprises. So if it's to treat calves with pneumonia, you have separate bottles for your different species on your farm, is how I would suggest it. Okay, brilliant. And then there was just a question about buying in antibiotic resistance, which I thought was just quite worth mentioning in terms of there's talk about buying in resistant worm populations. What about antibiotic? Yeah, so any bacteria can bring resistance. I'd say you're more like the populations of bacteria are different. And we had that conversation about what's in the environment. It's as much your flock and your farm. If you've misused antibiotics on your own, within that group of animals within your own farm, then it's not just the animals that might be carrying antibiotic resistant bacteria, but it's also the whole farm environment. So it's less of a thing buying in as potentially it is with wormers, although it's not impossible. When you buy in, there's bacteria everywhere, so it's not impossible, but the risks are mainly what you're using and practices around your farm, your flock, I would suggest. Yeah,
Okay, brilliant. And just somebody's put the sheep scab survey already in the chat, Fiona. But I think, is it just worth mentioning, it's not just for farmers who suffer from scab, is it? It is for
Yes,
all
I
farmers,
saw,
whether you have scab or you don't have scab, or whether you've got neighbours
yes,
that have scab. It's literally to try and get an idea of everybody's experience, rather than finding where the scab is.
oh yes, totally. If you farm sheep in GB, England, Scotland or Wales, yes, please do go to the survey. It doesn't matter whether you've seen scab or you haven't. We're really interested in your opinions. And yes, thank you to Paul who put it up there. So scroll back up through the chat and Paul's put the link in. And we've also got the link in the Sheep Farmer, which is either just out now or about to be out, or either way, this edition of Sheep Farmer, that there is a link in there to the sheep scab survey, so please don't miss it.
Okay, brilliant. Right, so we'll just move on to Fiona Kenyon for a few questions as well. Fiona, so Ian's asked us about how do you account for gut fill between weighings? That's quite an interesting one, because I was asked that quite a lot with sheep weighing. So
yeah, so the studies we've looked at, so what we tend to recommend is that people weigh roughly at the same time each day and weigh as soon as possible after gathering the animals in. And by doing that, some of the studies we've looked at have shown that we can get a period of 2 or 3 hours where there's not that much difference. You know, the weight gain in the animal, or the weight of the animals, doesn't change significantly over that period of time when they come in. So I think there is an element of, you know, gut fill can change at different times and weather conditions, as Ian mentioned, but it doesn't account for enough of a change to be a major problem. When we're doing the systems over time, we tend to have the animals being weighed, you know, every fortnight-ish up to every month. So it's that kind of time scale. So that's one way of dealing with gut fill, basically, is we've kind of looked at it and we're not too concerned about it.
Okay. Another question is, at what stage in the lambs should I start doing a FEC? At the moment, I'm just treating when I think is necessary, but they know it's not the right way and they don't really have weighing facilities. So,
yep. So in some ways, it depends what worms that you have on your farm. So if you have nematodirus on your farm, that's the infection that can be in really young lambs and cause scouring. You can try and look for egg counts there, but the problem there is that sometimes the scouring and the problems happen before we see an egg count, because it's the larval stages of those parasites that cause the problems. But it still can be useful if it's not a really acute attack. You know, if it's building up over time, you can do that. And you think lambs can get it from about 6 to 8 weeks, you know, so it's quite an early infection. But you can go to the NADIS website to look at the Nemesis Forecast, which can help you identify when it's likely that you could have an nematodirus problem and treat according to that. For later in the summer, really trying to take regular egg counts throughout the summer. So any time from kind of 6 weeks to 2 weeks, 2 months old, will allow you to build up a picture of, and if you can do that regularly from a group of animals, say 10 to 15 animals in each management group. I think you said you had 50 ewes, so yeah, depending on how they're managed, you don't need to do every animal, but you can do either individual samples, or you can take an equal amount of feces from, say, 10 animals and pool that and count that, and that'll give you an idea of what is happening, what's been put out onto pasture, and give you an idea of when to treat. And again, going to the Scops website, there's lots of really useful information on the Scops website with some ideas of kind of thresholds that are low, you know, worm counts, medium and high, if you don't have homunculus on your farm.
Yeah. Okay.
Is that much question than you think, that one, really?
Yeah, exactly. You could just say X weeks, but actually it's never as simple. But I think that's why worms is such a fascinating topic, because there is no quick answer, is there?
Exactly.
Okay, Eleanor, I'm just going to come to Eleanor for a second. This is where I can't find the question. Are the new Red Tractor standards on health and safety policy worth the paper they're written on, in that if people are inspected by Red Tractor and they think that is up to standard to equivalent of health and safety executive, could there be a danger there that people think they're compliant when they're not? And are Red Tractor sort of qualified enough to have that analysing of the health and safety policy? What are your thoughts on that one?
It's a very good question. I'm probably not the best person to answer that. I don't feel like I'm probably qualified to sort of answer that in a sort of very you know, one way or the other, really. So it's probably best that yeah, we look into that a bit more so that we can work out what we would respond to that, or that whoever asked that gets in touch with us and we can look into that more for them.
Okay, so if farmers have got a health and safety policy, then who can they check it by that they are compliant? What's the best thing for farmers to do?
Well, again, I'd say probably best they get in touch. Stephanie, who manages our charity, is far more up to date on all of this than me. Obviously, the HSE are, you know, they're the executive that deal with things like health and safety in the workplace. So they're probably the sort of best people to kind of have a view on that kind of thing, and whether you're compliant or not. But
Okay.
yeah, definitely something we'll look into, because yeah, it's not something I've really done much on, so I wouldn't like to answer one way or the other.
Yeah, no, that's fine. I think the intention is, if someone's gone one step to have a policy, to then find it isn't good enough would be a shame, because you've kind of you've gone to for that first step, haven't you? And then you don't know whether what you're doing is right or not. And that would be applied for many things. Okay, that's fine. Right, okay, I think there are some other sort of smaller questions, but most of them I think have been answered in one form or another. And actually, to be fair, a lot of them have been answered online. So just in the interest of time, Phil, are you happy that we come to a close? So just for those who haven't had a question answered, all the chat and the Q&A will be saved, and then we will have a look at it right at the end, and then any sort of common questions coming up, but I think we have answered them as much as we can. We will sort of see what we can do about putting a Q&A on the website or something at the end of the 3 days, if that's all right with everybody.
That's great. Thank you, Neris.
Okay.
Okay, well, we, as Neris said, in the interest of time, is 10 to 9 now, so we want to come to a close. Really, it just remains for me to thank everyone for participating this evening. Thank you very much for our speakers. Thank you very much again for the organisers, the NSA Southeast Committee who pulled this whole thing together. And thanks to all the attendees, the participants that have joined us. We've had a really good turnout tonight. I also want to say a huge thank you to our sponsors as well, in particular this evening, Rapper, Elanco, MSD and Datamars as well. You know, without the support of companies like this, just helping a little bit financially, it would be really difficult to lay these events on. And in doing so, you're really contributing to the work of the NSA. So a huge thank you to the sponsors for contributing this evening. And also just to remind people that this isn't the end tonight. You know, this the SHWAP conference goes on for 3 nights, tomorrow night and Thursday night. And tomorrow night's subject is around grassland, mixed wards and grassland within arable rotations, another hugely popular subject, very much of the time. So I'm sure we'll get a good attendance, but please, anyone who wants to rejoin again tomorrow night, do. And then on Thursday night, it's another very popular subject of the next generation. And I'd have to say that NSA Next Generation is one of the most inspiring areas of work that we've ever got involved with. I think, you know, that bringing the next generation in, encouraging them and supporting them through a transition into either a business or a career within sheep farming is really worthwhile and very rewarding. So that's going to be Thursday night's subject. And yeah, I hope as many of you can join the following 2 evenings as possible. So just again, another final huge thank you to Fiona Lovatt, Fiona Kenyon and Eleanor Sanger for speaking tonight. And enjoy the rest of your evening, everyone, and have a productive day tomorrow, and hopefully join in again tomorrow evening. Thank you. Good night.